Now, the COVID-19 pandemic has overemphasized the need for countries to establish their own national emergency management teams to provide support to the response to the pandemic. This is in line with the establishment of the World Health Organization's Global Emergency Medical Team. The initiative was established in 2014 following the earthquake in Haiti that left many communities nearly ruined. A total of 25 medical officers and nurses constituting the National Emergency Team is currently participating in the training. Joining us here on set, Dr. Kaveto Sikuvi, the head of COVID-19 case management, as well as Dr. Ismael Katjitae. Good morning, gentlemen, and welcome to Good Morning Namibia.
Good morning, Denver.
Good morning.
Good morning.
Thank you for having us.
Dr. Katjitae, please talk to us about the background of this training.
Yeah, the background of the training, as you mentioned, it actually started off with following the earthquake in Haiti in 2014. It was actually realized that many countries, or all the countries, have got to find a way of responding to their own emergencies. Yes, there is always an international support where different teams are deployed from various countries, but the most important thing, what was actually realized, was a need for every country to establish its own EMT team, which can respond immediately. It's easier to respond immediately rather than actually waiting for other teams to arrive. By that time, when they have actually arrived, the extent of the damage and the extent of the suffering might have actually gone beyond repair. And this is the reason why this initiative was started, that countries should actually start training their own teams, but at the same time also having so many EMT teams arriving in the specific regions, in the specific areas where these disasters have struck. You need to have a lot of coordination. And they also need to coordinate in terms of what they are doing. They need to apply the same rules, they need to apply the same principles, because otherwise it's actually going to be very chaotic if everyone is just coming with his own rules and trying to apply the same thing. So the standards had to be the same, and this is the reason why this initiative was brought on. You all know that we went through our third wave of COVID, and clearly we were also in the same situation where our systems were actually in many places actually overwhelmed. You remember the problems with oxygen. We remember the problems with even bed space, ICU capacity. Yes, we did manage to do that, but to some extent we were also overstretched. And this is the situation which actually made us, in fact, actually even to call on help from outside. You remember that there was an EMT team from the UK which did come and support us. But this was just the beginning of everything, because this was just a response to COVID. But nevertheless, disasters can happen anytime. We might be having a big accident, typhoons, earthquake. We've so far been unscratched. We've been just observing from the side, looking at these things happening in other countries. But these things can also happen in Namibia. And at that time, if that happens, then we will have to have the capacity of helping ourselves and not just having to rely on other countries.
Thank you, Doc. Dr. Sikuvi, for the past close to 2 years, you have been in our TV screens consistently reminding us about compliance and its importance to public health regulations to curb the further spread of COVID-19. What do you make of the trigger, as Dr. Katjitae called it, to the training?
So thank you again, once again. So see, the training, especially the initiative, the Global Emergency Medical Team initiative, basically is mandated to make sure that there's training and also putting quality standards in management of diseases, and also not necessarily only diseases, or it has to do also with sudden emergencies, disasters, and as well as COVID. As you rightfully say, for the past 2 years we have been in COVID. So basically it is to enhance training, okay, and promote rapid rapid deployment when there is a disaster. So currently we are in COVID-19, so hence the current initiative that we have to do training, or we have to do induction for emergency medical team for our country, so that we are able to respond or to be deployed rapidly into where there is a need. For example, as Dr. Katjitae said, third wave, it was a wave we want to forget, or we don't want to experience again. So in terms of respond with this EMT or emergency team is to make sure that wherever there is a need for capacity assistance, then we have a team that will rapidly be deployed to help out in terms of management of disease, and also coordination and making sure that everything is under control.
Thank you, Doc. Dr. Katjitae, so let's talk specifics. What has been happening in Swakopmund over the past week?
Yeah, we have, following our trip for training in Uganda, we were a team of around about 8 Namibians, Dr. Kaveto, Sikuvi, and myself, but also 4 or 5 other members joined us. We traveled to Uganda, obviously supported by WHO and also our government. Went there, and then we went for induction training on EMTs. And this was basically the whole, we got training to learn what this EMT is all about, what is actually expected, what are the knowledge, information which you have got to have, and what is actually expected from you. This is not a very easy thing to be able to be involved in, because sometimes you are actually deployed in areas which are sometimes in hospital. They sometimes, as you have actually seen, international teams being sent in areas where there is sometimes political strife or problems, but also just in emergency situations. If you think about those disasters, there is a lot of, you just think about all these landslides and these mudslides which we are seeing. First of all, they bring in a lot of trauma. They cause a lot of traumatic injuries, but then after that, they are followed by infections. The water systems, the sewage systems, the sanitation system, completely destroyed. And you need to look at that. So the whole picture of the EMT is actually not just about just health delivery. Yes, they have got to come and deliver health, but at the same time, they also need to be very self-sufficient. They've got to have their own logistic team. They've got to have their own administrative team. And these are the type of things which we actually went to learn. And then when we came back, we then decided to start our own team. And obviously, as we said, we had 25 people who are now here, who are undergoing this training. And they consist of different cadres of people. They are administrators, they are healthcare workers, nurses, doctors, and there's also emergency people, drivers, ambulance drivers, and the whole lot. So it's really a full package of logistic thing. It doesn't just depend on one profession. It's a mixture of individuals. And when they've got to be deployed, they will have to be ready to move as a unit and not just have one group of them. And that is basically what we've been doing over this last week. We had them here, and we've been conducting daily trainings. Obviously, the training was actually conducted by us who have actually been going there, but we're also lucky that we had someone from WHO, an expert, a medical expert as well, who was also involved with our training in Uganda. He also came here and supported us. And that is roughly what we've so far been doing. So far, we've been doing a lot of practical and theoretical trainings, and today will be our final day where we will have to, what we have so far been learning, to bring into practice. We will go on simulation training, but we will try to create a real life scenario to the extent that the trainees have got to now start bringing out their skills. There's a lot of things. I mean, there's a lot of things in terms of actually looking at health standards, principles, but there's also a lot of things where they will have to bring out things like negotiations, being able to negotiate their way out of difficult situations. There's obviously also a lot of stress which is actually involved with it.
Indeed.
And they will have to show themselves that they can handle stress, and should that happen, how are they going to actually maneuver themselves out of that.
Thank you,
and
Doc.
how they're going to recognize it. Thank you.
Thank you very much, Doc. Now, Dr. Sikuvi, as shared to us by Dr. Katjitae, what you learned in Uganda is what you're teaching this week. What is your take on the curriculum of the past week, but also specifically on today's simulation?
Okay. Yes, the curriculum is basically broad, okay? Wide range of activities from administration, logistics, coordination, as well as clinical management of patients. So that is how broad it is. So, and looking at the first day until yesterday, first of all, let me say that the participants have been very engaging, and they have learned a lot from our conversation and activities that we have gone through. So with management, and we actually zoomed in a little bit in management of COVID because we are currently in COVID. As I said earlier on, the training is not only for COVID, it's for any sudden emergencies, disasters, or whatsoever that can happen. So now all that we have learned over the past 3 days, today we will have a simulation to see what the participants or the trainees have really acquired over the past 3 days, and then put it all together into action. As Dr. Katjitae has said, from logistical point of view, how the team is going to coordinate its own team, you know, security of the team itself, and then the environment, how to be aware of the environment, any danger that may be associated to the team itself, and also where they are going, and how they are going to incorporate wherever community they are going to offer their support there, how they are going to mend in and then work with the local leaders, local healthcare workers, and so forth. So this is basically a broad kind of training.
Thank you.
Yes, thank you very much. Yeah.
Now, unfortunately, we find ourselves at the start of the fourth wave of COVID-19, also with the onset of Omicron. Very briefly, talk to us about our management of COVID-19 at the moment.
Okay. First of all, let me say Omicron, what we know so far is that it is more transmissible, okay, than the Delta. However, in terms of virulence, we are still observing how it goes. So far, we have seen that there's a lot of mild cases, not necessarily as we have seen in Delta.
So far being the operative phrase.
So far. So we are still in early days. You know, what we have learned is that this pandemic has more of surprises. You never know what can happen. So that's why we are very cautious at the moment and making sure that we adhere to health regulations to prevent further spread. However, that being said, perhaps maybe you have also heard of a friend who is having flu or so. So basically, currently, that's what we are seeing. You know, flu kind of symptoms, sore throat. Currently, and then, you know, though there are some hospitalization, not compared to Delta at this stage.
Thank you, Doc. Thank you, Doc. Dr. Katjitae, I wish we had a lot more time to go into more detail as far as EMT is concerned, but we will have you back at some stage for more feedback. Your concluding remarks this morning, please.
Yeah, it's, again, as I say, this was the initiative which we have actually taken up is really for the people of Namibia to know that we cannot just rely on outside help. We need to start taking up that initiative ourselves and start preparing ourselves for whatever can possibly come. The things which are happening in other countries can also potentially also happen here. You remember the beginning of the Delta wave with the third wave. We first saw what was happening in India, and we thought that these things will never ever come to us until they really came to us. And that's the reason why we, on the longer run, realized that we will have to get prepared to be able to reach out to that. And again, again, if we currently finding ourselves in the fourth wave of COVID, we still, though what we are experiencing is relatively mild symptoms, there are very few casualties. We still need to apply and adhere to the same rules which we have actually been practicing in the previous waves.
Thank
to
you,
make
Doc.
sure that our numbers still remain low.
Okohepa. Thank you very much
Thank
for
you.
taking the initiative, and thank you for the great work that you're doing in the fight against COVID-19.
Thank you.
That was Dr. Ismael Katjitae and Dr. Kaveto Sikuvi talking to us about emergency medical training. We'll be right back after a brief break.